Bismillah ar-Rahman ar-Rahim, my dear MRCS candidates. This is the second lecture of the series How to Pass MRCS with Examiners Help and Artificial Intelligence Help. My name is Dr. Muhammad Omar Farouk, I'm a consultant vascular surgeon. We have in the last lecture agreed that the way we're going to communicate is through this Telegram group. You can stop the video and picture this QR code, and it's a public group, so you can join in. And we said if you want to have virtual OSCE station to be examined by me, you can fill up this form, which is a Google form, and I will enroll candidates as they come in, first come, first serve, to examine them virtually and to let them know how they have performed well, when areas of improvement, and what we need as an examiner for the candidate to do. So you can also welcome to join this group, this Google form. Now, structure of the exam, I'm going to give you a few details about the broad content of MRCS exam, which is a beautiful system to assess your performance, how to proceed forward in surgical training. We assess candidate in 4 areas, and these 4 areas are very important for you to know. They are 18 stations, and you will have 2 resting stations. Each station is around 9 minutes, and there is 1 to 2 minutes to go outside the room to shift to the second station in the row, and there is 1 minute to read the instruction before you go into the station, and then you go to the station. And there is 2 resting stations where 2 bays, you just have a bit of water, a bit of coffee, a bit of relaxing before you continue, and this lower the stress of the exam a little bit. Now, these stations are 18 stations are distributed as follows. Anatomy is 5 stations. So anatomy and surgical pathology are 5 stations in every exam. Applied surgical science and the clinical care are 3 in every exam. And clinical and procedure skills are 6. They are divided into physical examination, which is 4, and procedure skills, which is 2. Procedure skills like incision of an abscess, putting a catheter, putting venous access in a patient, suturing wound, really basic procedure, but there are fine-tuning how you perform. And communication skills, which is widely ignored by the Egyptian colleagues. And they are extremely important. One of the very common cause of not passing the exam is communication skills, which are 4. Giving and receiving information, 2 stations, and history taking, 2 stations. And we'll give you example of these stations using artificial intelligence. Now, the anatomy and surgical pathology, if you want to fine tuning, there are 5 stations altogether. 3 are basic anatomy. And this is very important for you, like skull, upper limb, lower limb, anatomy of the abdomen, thorax. All this are very important for you to memorize, and we'll do some testing for that. Now, 2 surgical pathology, which is histopathology team, and 1 other station, which is microbiology teamed. So they are focused on these 2 areas, and I will show you which books you need to read using artificial intelligence. Applied surgical science and the clinical care are 3 stations. 1, exploring common clinical acute scenario. 1, exploring how you interpret and use investigational data, which is important in your career. And 1, exploring interpretation and using imaging data. So these are the three applied surgical science and clinical care, and each one of them is measuring a certain part of your skills. Now, clinical and procedure skills and physical examination, we said there are four: physical examination, examination abdomen, upper limb, lower limb, chest, critically ill patient, all of them are physical exam. We used to have a real patient, now it is mainly replaced by actor. You should know, for example, if I get you a patient to examine the knee, it wouldn't be obviously that he is a patient. Because if you examine the knee with all the movement at the end of the day, you cause damage to the patient. So he is an actor. And examining an ankle, he is an actor. Sometimes we get varicose vein as a real patient because there is no harm in doing examination of the veins at the end of the day. So these are the stations for physical examination, and there are two stations which test your common surgical skills and the aspect of patient safety. For example, a lot of things for incision and drainage of an abscess. If you forget to put the knife in the sharp pin, then you lower your marks. How you hold the needle holder, how you hold the knife and the scalpel, how to take permission of the patient and make sure that he is a correct patient and sees a consent form. Both station measuring the whole of surgery as much as we can to measure your skills. So communication skills, which we said they are four: two, communication with the patient and the carer, and this will be examined by two. One is a surgeon, one is a lay examiner. And how to communicate with a colleague is also in the communication skills, which is the phone station, how you can call the consultant in the phone and see how you manage a patient. Also, two station in communication skills, which is history taking. Both are generic. Surgeon with lay examiner. Now, the next is a very famous exam matrix to show you how you are being graded. And this is very important before you go to the exam. And this is a beautiful, beautiful image, which you can see here. And this image is not private or confidential. It's being published in MRCS books, so you can easily know exactly how you are being assessed. So notice here in the upper corner, he divided the what you are examined for. Okay, and so applied surgical science. Here is the communication skills. The two stations of giving and receiving information, and two stations of history taking. Here is the procedure skills, physical examination, and the procedure skills. Here is the name of the Royal College representative who have really put this scheme. A very dear friend to me is Kim Suvama. Kim Suvama is one of the important British pathologists. God bless him. He has died last year, and I did enjoy his company very much. We used to sit down and write OSCE station for the Royal College, and his knowledge is unbelievable. But he was uncontactable because of a lot of medical legal cases that he's in charge of. Kim is a famous pathologist, likes a new idea and like testing your skills. I remember he told me, "Do you think of tumor less than 1 millimeter can kill a patient?" That was his question to me. And I told him, I don't know. And he said, yes, if you have a tumor near the SA node, it will cause arrhythmia, cause ventricular fibrillation, and you can die. And Stuart MacDonald, a very dear friend as well. And here are the station anatomy 1, 2, 3, and pathology, microbiology. All of them here is one examiner needed, as you can see. And these are the marks 20 for the clinical knowledge, 20 mark, but we also assess your technical skills. And these are the mark for the technical skills. You see here, history taking mainly technical skills. Because here I'm not testing your knowledge, I'm testing how you take history. And communication skills, you can see in this information here, 12 grade out of the whole station is communication skills. You see, communication skills is extremely important for you to pass. The total of any station is 20, but sometimes we get a pilot station. This is a test station, a testing station that you you're not going to be great, but you will not feel it as an examiner. So sometime if you do very badly in a station, don't worry, it might be a pilot station. So the grades will not be calculated. So don't worry, this is called the pilot station, and this station is being tested before it goes into the scenario of the Royal College. So this is a great overview of the exam. Why this is important? Because without this overall view, you must know how you're being graded. A lot of people does not think communication skills is important. So this is very important for you to know. So this is a very important overview of the station you're being examined and how your grades is being calculated and the importance of these grades, and the pilot station, which is station that is being tested, how it will perform before it is enrolled. So there is no grade for these stations. So this is very important. It's not confidential. It is public, but a lot of candidates does not take care of it. Now, these are the broader content that we are measuring. We're measuring knowledge. You need to study for that, and we're measuring skills as well. So if you're just going for the exam by reading, you will not pass. You must sharpen your skills, know how it's being tested, and improve it. And that is why we're going to do virtual OSCE station. And this is the matrix which hasn't changed since the beginning of the MRCS. These are the ways we assess you in the domain. You assess for your clinical knowledge and how you apply your clinical and technical skills, and communication skills, and professionalism. Professionalism is how professional you perform your job and your task. And this is extremely important. This was due to a big discussion between General Medical Council and the Royal College that they said to the Royal College was not looking for candidate who just knows the information, but we need a candidate that can deal with the patient in a professional way and can communicate with others. That is why these two parts has been added, which was not in the old FRCS exam. And this is the way we assess. There are two ways you're being assessed in any station. Number one, the global judgment or the overall performance, which is one of three. You either pass or you fail and you borderline. And we always, as an examiner, try to decrease the borderline. So you either pass or fail. When do you have a candidate that fail? If you really done a fatal mistake. Simple mistake, sometimes you don't fail, but a fatal mistake. Let me give an example. There is a station where I show an X-ray with a nasogastric tube which is being diverted over the patient right hand side. So this nasogastric tube was wrongly placed in the bronchi, in the right bronchus, not in the stomach. And the scenario goes how you test the nasogastric tube that is being in the right place, what do you do, and so on. And at the end of the question of the station, would you tell the nurse to start nasogastric feeding on just this chest X-ray? If you say yes, you have actually killed a patient. Now you have put nasogastric tube in his right bronchus. There is no way around it, even if you answer before that perfectly. If you say this answer, you fail. And a lot of other things as well, like fatal anatomy mistakes, many other scenarios. Now, the other way of assessment is grades. So you get grades for professional score, and you get grades for your knowledge, you get grades for your communication skills, and so on. And this is only done by an examiner. But notice that it's a group of 18 examiners that will collectively make your mark, not just one examiner. Sometimes you get a good examiner, sometimes you get a bad examiner. But the overall is more or less as fair as humanly possible. Now, how the marks are distributed, two very important slides. This slide will show you the grades, how it's being distributed. So the yellow is the communication skills, and procedure skills is the blue. So nearly half of the exam, nearly half, is communication skills and um, clinical and procedure skills. So these are very, very important. And this is the distribution of your mark in the exam. The very important also uh, slide is the domain mark distribution. And you can see that clinical knowledge and its application is nearly 50%. So 50% is the clinical knowledge, and the rest is distributed equally between clinical and technical skills, communication skills, and professionalism. But the clinical knowledge, how you apply the knowledge, is what is nearly half of the grades. So I hope with this lecture I have given you an overall view on the MRCS examination structure. I will show you how you can use artificial intelligence and keep enrolling into the virtual OSCE station, because the main part of this course is testing your skills being assessed before you go to the real exam, to show you where is your defect, where you need to improve in order to pass the exam safely. Thank you very much, and I wish you all the best. And this is the end of the second lecture of this series. Thank you very much.